Good afternoon, everyone. It's July the 4th, 2021, and you're welcome to this video where I'll be talking about the long effects of COVID 19 that sometimes is called long COVID. We all know that people continue to discredit the effects of COVID 19 and the risk of dying from COVID 19, and hence they continue to see the scientific guidelines as an unnecessary inconvenience. But that's the mistake everyone is making, and the reason we make this YouTube video. We know that mild to moderate COVID 19 usually lasts for up to 2 weeks, and many people are able to heal. But there's a growing evidence of residual complications of COVID 19. And we must note that this is a growing area as more data becomes available. The common symptoms include one, fatigue, and this is usually the post-infection fatigue that we see with even many other viral infections. There's chest problems, and this is because the lungs are usually really the primary site of infection, and these chest problems commonly present as shortness of breath, chest tightness or chest pain, dry cough. This shortness of breath is sometimes worse on exercise or exertion. The other common symptom that we see in people is joint pains. One other common symptom that we see is lost or distorted senses of taste and or smell after COVID-19. We know that up to 25% of those who lose their taste or smell could regain it within a few weeks. And the remaining 75% are expected to regain within the next 1 year. Wait to see. Other issues include problems with memory and concentration, that is called brain fog. So basically, people feel like their ability to think, their ability to remember, and overall intelligence is diminished after COVID-19. Dizziness, sometimes that is more pronounced on standing up from a sitting or lying position. Depression and an overall poor mental health, and this could be further extended by health issues, people feeling sick or loss of loved ones, post-admission. Insomnia, or it's called COVID insomnia, happens. People lack sleep. Feeling sick, people may continue to feel fever, diarrhea, vomiting, joint pains, and generally feeling unwell even after suffering from COVID-19. Others include muscle pains, headache. Then I want to emphasize on the issue of heart inflammation that occurs in 60%, including, by the way, mild cases from one of the studies. And this could manifest as still chest pain, could manifest as breathing difficulty that is worse on exertion. Another symptom, on and off fever. Then studies are continuing to look at the possibility of developing type 2 diabetes. Of course, worth of note is that there could be people that have developed these even when they have recovered from COVID-19 without necessarily being diagnosed. So I would also imagine that many health workers are increasingly seeing some of these symptoms that are unexplained. Long COVID would occur from a few weeks up to a few months or a few years, we don't know. Treatment, usually there's really need for continued rehabilitation in the form of respiratory exercises, physical exercises, and symptom management. I have put a link in the description uh, on how respiratory exercises can be done. So the fact that effects of COVID-19 continue to occur even when people have healed from the infection underscores the need to pay attention to preventive strategies as outlined by the authorities, including Ministry of Health and the World Health Organization. We need to see that death is only an extreme complication or an extreme outcome of COVID-19. We should see a doctor when we get any of these symptoms, because these resemble symptoms of many other diseases and conditions. So shouldn't take it as long COVID unless you've seen a doctor and they have assessed and concluded that this is long COVID, because it could be something else. Let's continue to pay attention to the guidelines and stay safe. Thank you very much, and have a good day. And since you are here, I'm planning to be making more of these videos. Literally like my lockdown hobby, and feel free to, if you find them, if you like them, if you find them helpful, feel free to circulate them, feel free to share them, feel free to like and comment if you have any suggestions, any comments, and feel free to subscribe to the channel to be among the first people to see some of these. Otherwise, thank you very much for your time, and see you in the next one. Thank you very much.